When the Western Roman Empire fell, Greek medical knowledge survived because Islamic scholars saved it. In the 8th and 9th centuries, the Abbasid Caliphate in Baghdad funded the systematic translation of Greek texts into Arabic. The House of Wisdom became the greatest repository of medical knowledge in the world. Hunayn ibn Ishaq translated virtually all of Galen's works into Arabic and Syriac. He did not merely copy, he corrected errors, compared manuscripts, and assessed their reliability. Islamic scholars did not passively preserve ancient knowledge. They critically evaluated and improved it. This was the Islamic Golden Age of medicine. Ibn Sina, Avicenna in the West, wrote the Canon of Medicine around 1025 AD. It was not a collection of earlier knowledge. It was a systematic synthesis, organized by Ibn Sina's own logical framework. 5 books covering general principles, simple drugs, organ-by-organ disease, general diseases, and compound remedies. It became the standard medical textbook in Europe for 600 years. The Canon introduced clinical trials in embryonic form. Ibn Sina specified conditions for testing drugs: the disease must be uncomplicated, the drug tested alone, compared with untreated cases, and the effect consistent across patients. He was describing controlled experimentation in 1025. Europe would not reach this standard for another 700 years. Al-Razi, Rhazes in the West, was the finest clinical physician of the medieval era. He compared patients systematically, kept careful records, and published the first clinical distinction between smallpox and measles. His clinical description of these two diseases, written around 900 AD, remained definitive for centuries. Al-Razi designed Baghdad's hospital with a crucial innovation: isolation. Infectious patients were separated from others. He selected the hospital's location by hanging meat in different parts of the city and building where it rotted slowest, inferring cleaner air. His reasoning was empirical, his conclusion correct, his mechanism wrong. He was doing evidence-based medicine. Islamic pharmacology transformed medicine. Muslim scholars developed distillation to a high art, producing pure plant extracts, essential oils, and alcohol-based preparations. The word alcohol is Arabic, alcohol. The word drug comes from Arabic dirhak. Islamic pharmacy gave Western medicine both its medicines and the words to describe them. In 1242, Ibn al-Nafis made one of medicine's most important discoveries. Galen had claimed blood moved from the right to left ventricle through pores in the heart's wall. Ibn al-Nafis dissected hearts, found no pores, and correctly described pulmonary circulation, blood flowing from heart to lungs and back. William Harvey gets the credit in Europe. Ibn al-Nafis got there 300 years earlier. Islamic medicine excelled in ophthalmology. Almar ibn Ali al-Mawsili invented the hollow needle for cataract extraction, a technique used for 1,000 years. Ibn al-Haytham's mathematical optics transformed understanding of the eye. The surgical treatment of cataracts, one of the most common surgical procedures today, traces its lineage to Islamic medicine. The Bimaristan Islamic Hospital was an institution without precedent in the ancient world. It had separate wards for different diseases, male and female sections, running water, and gardens. Staff included physicians, surgeons, pharmacists, and nurses. Patients were discharged with money to cover their recovery period. This was state-funded universal healthcare in the 10th century. The return of this knowledge to Europe happened through translation. In 12th century Toledo, a city that was part Christian, part Muslim, part Jewish, scholars translated Arabic medical texts into Latin. Avicenna's Canon, Al-Razi's clinical works, and the preserved Greek texts all entered European medicine through this Islamic transmission. Islamic medicine was not a temporary bridge. It was an 8th-century tradition of original research, institutional innovation, and clinical progress that preserved the ancient world's knowledge, extended it, and transmitted it to the modern one. Every physician in the world today practices medicine that passed through the hands of Islamic scholars. From the House of Wisdom preserving Greek texts, to Avicenna synthesizing them into the Canon, to Al-Razi isolating infectious patients, to the Bimaristan providing universal care, to Toledo scholars returning the knowledge to Europe. Islamic medicine did not merely bridge antiquity and modernity. It advanced medicine in its own right. I am Takku. While Europe slept through the Dark Ages, Islamic physicians kept medicine alive and advancing. Subscribe to Wisdom of Takku, because wisdom has never respected borders.